length of the bowel, and you have the anal marker. So you want to know, do I have enough bowel to reach the anal impression? And you're going to think, how do I want to prep this patient? Do you want to go lightly? Do you want to do oral antibiotics? Do you want to irrigate both stoma? Do you want to irrigate the proximal stoma only, or do you want to irrigate the distal stoma only? And everybody can vote, and we're going to move to the answers. Irrigation of distal stoma only. Very good. So we're going to go back to the image. So here, you have plenty of bowel for the pull-through. You're going to enter posterior sagittally, and you are going to find the rectum. So you're not going to have to touch the proximal bowel. So there's no need to do anything with the proximal bowel. We like to irrigate with saline solution just to get rid of that old mucus and sometimes residual meconium that hopefully is not there because you clean it out when you open your colostomy. So we just irrigate with saline solution. Now, what type of bowel prep does this patient need? So you are seeing the colostomy and you're seeing the distal colostogram. I have to say this is not a good distal colostogram because it doesn't allow me to know for sure what malformation is this. But let's suppose that it's giving us the information that you only have this piece of bowel. So what kind of bowel prep would you do? Go lightly in irrigation of the proximal stoma, go lightly in irrigation of the distal stoma, irrigation of both stomas, irrigation of the proximal stoma only, irrigation of the distal stoma only. Everybody can vote, and let's see the answers. So we have go lightly in irrigation of the distal stoma. So that would be the type of bowel prep that I would do in a patient like that. Why? Remember, this is not a perfect colostogram, so I don't know, but assuming that I'm dealing with a short colon, I have to be prepared to use this proximal colostomy. So that's why I'm going to do a bowel prep. What are my options in this case? I can close the colostomy, do the pull-through, leave the patient NPO for 7 days. I can close the colostomy, do the pull-through, and open a more proximal colostomy. I can close the colostomy. I can do a Hartmann pouch, but in this